So Thiago Morelli here from NEC Implants and Periodontics. So what I'm going to be talking a little bit today here is about the use of LANAP for periodontal disease treatment. So LANAP stands for like laser assisted new attachment procedure. So it's a treatment option that we provide to our patients when I would say you have a situation from moderate to severe periodontal disease, and it's a very effective treatment that provides us excellent results without the need to go surgical, without the need for cutting or suturing. And this is the machine that I use to provide the LANAP treatment. So it's a laser unit. The most specific name for this laser is the Nd:YAG laser. So it's a specific laser that can give us the results that is necessary to reduce the level of periodontal disease. So provide me the use of a very specific type of laser that penetrates into the gum tissues and kills the bacteria and allows the tissues to heal and give us the resolution of the gum disease. So one thing that is very interesting about the use of laser on treating periodontal disease is the fact that I can achieve very good results that usually I get with periodontal surgery without the need to go surgical with patients. In other words, we can get the best results without the need for cutting the gum, stitching, and then patients have a longer healing time and having more sensitivity. So the use of this machine, it definitely changes how we can provide patients a good result with the minimal trauma and the fastest healing as possible. We use LANAP most of the time for patients that have moderate to severe periodontal disease. It can be used by any type of periodontal disease severity, but I feel like the best results are when you use that for patients with moderate to severe disease. And those are the cases that most of the times I have to go surgical, but using the LANAP as the beginning, as the first therapy, what I found out is that the level of surgery that I provide to patients later, it is a lot less. So basically what we can do is we can reduce the amount of surgery that is necessary to control periodontal disease by using this machine and give patients a much better result that we sometimes cannot even achieve with periodontal surgery. So the usual recovery time when you use like a laser to treat periodontal disease, most of the time patients with a day or two after the treatment, they return to their normal routine. Like there's definitely a specific type of protocol that you need to tell patients what to do in terms of diet and how to clean their teeth for the first week after the treatment. But in general, they go back to their normal routine right after the procedure. Like they go back to work right after they have the procedure done. What I'm proud here in NEC Implants and Periodontics is that I don't like to provide one treatment for everyone. Like what I feel like it's very important is to identify the right patient for the right treatment. So I feel like it's very important is to get the right diagnosis. Like a lot of times, like periodontists and clinicians, we are providing like a treatment for like LANAP for every patient, which is in reality, it is not necessary. Like there are cases that definitely I understand and I see that these would be very useful and provide the patient the best result as possible. But there are cases that I don't see that the use of the laser would be the best for the patient. So there are definitely certain indications that we have to understand and follow some protocols. So definitely having a consultation is the best way to learn if this is a good treatment option for you. So here we also have another type of laser, what I'm not going to call the LANAP, but it's also a laser treatment option that we offer, which is this machine here. So with this machine, I can provide the same laser that I use to treat patients with the LANAP machine, but I also have the advantage of using another type of laser that is very helpful when I have to treat implants, for example. So it is very effective, and a lot of times when patients have bone loss around implants, the most difficult portion is to clean the implant surface. So having something like a laser that allows us to get that surface really well clean, it improves the chance to save the implant and, most important, avoid any further bone loss. So if you want to learn more about LANAP, if you have an indication to receive this type of treatment, I invite you to visit us at northcarolinaperio.com or give us a call, and then we can discuss, schedule an appointment, and I can give you more details on how we can get this done.